I'm Ravi Bamba.
I'm Gupta.
And I'm Higdon from the Department of Plastic Surgery at Vanderbilt Medical Center. We are here to discuss our paper, Evaluation of Diabetes as a Risk Factor for Major Complications in Patients Undergoing Aesthetic Surgery, which will be published in the upcoming May issue of the Aesthetic Surgery Journal. Diabetes has been linked with a variety of perioperative adverse events across surgical disciplines. There is currently a lack of prospective multi-institutional data looking at outcomes of cosmetic surgical procedures, including diabetes.
In our study, we compare the incidence and type of complications between diabetic and non-diabetic patients undergoing various cosmetic surgical procedures. We identify specific procedures where diabetic patients have significantly increased risk of complications and study diabetes as an independent risk factor for major complications following cosmetic surgery.
We reviewed a large insurance database that represents outcomes of board-certified plastic surgeons in the United States. Over a 5-year period, over 129,000 patients underwent cosmetic surgery, with 1.8% having a pre-existing diagnosis of diabetes. The most commonly performed procedures on diabetics were abdominoplasty, breast augmentation, and liposuction.
Among all patients, 1.9% had a major complication. This complication rate for diabetics was 3.13% compared to 1.92% in non-diabetics. In a univariate analysis, infectious and pulmonary complications were significantly higher among diabetics. Complication rates were even higher in diabetics with a body mass index over 30. Notably, diabetics had statistically significant higher risk for complications in body cases and specifically abdominoplasty.
On multivariate analysis, after controlling for effects of age, smoking, obesity, gender, type of procedures, and surgical facility, diabetes was found to be an independent risk factor of any major complication with a risk factor of 1.31 and for infection with a relative risk of 1.70.
In conclusion, the prevalence of diabetes among aesthetic surgery is low. Diabetes is an independent risk factor for major complications, particularly infection, after aesthetic surgical procedures. Thank you.
Thanks.
Thank you.